Hello everyone, this is me Sidratul Muntaha. Once again, welcome back to Do It in the Dark. In my last video, we discussed the basics of uterine fibroids. Now, in this video, we will discuss the sonographic appearance of uterine fibroids. Let's start the video. How does uterine fibroid look like on ultrasound? Okay, there is a specific appearance which we should keep in mind while doing ultrasound of patient with signs and symptoms suggestive of uterine fibroids. So the first question is how uterine fibroid look like on ultrasound. It is important to know that uterine fibroid most often appear on sonography or sonogram as concentric solid hypoechoic masses. We have hypoechoic masses means slightly darker in color as compared to surrounding structure. This is very important to know. For instance, if we look at this ultrasound image of the one patient, you can see the normal myometrium at one place and also a small hypoechoic area of myoma or mass. Okay, that hypoechoic area is most probably the uterine fibroid. So we have to keep this thing in mind. Now, another question that usually arises is that what causes the specific appearance of fibroid? We have said that yes, the uterine fibroid is the one in which there is concentric solid hypoechoic mass. So, why is there hypoechoic appearance? Why is the appearance of fibroid is different from other tissues? The answer is that it results from prevailing muscles which is observed at histological examination. The muscles are not observed on ultrasound. If we do the histological examination of the uterus, which has been hysterectomized, only that will give us the confirmation confirmatory report. So the prevailing muscles there, because of them we have specific appearance. These solid masses absorb solid waves and therefore cause variable amount of acoustic shadowing. So you can see the specific appearance in this ultrasound image. You can see concentric solid as well as hypoechoic masses. Now, pedunculated fibroids, mostly patients have pedunculated fibroids or pedunculated intrauterine fibroids on ultrasound, which not in good quality. Usually you see there is increase in the endometrial thickness. If we use good quality of ultrasound machine for scan, we can easily identify and diagnose fibroid, specifically pedunculated fibroids. So there are usually echogenic masses. You can see a little bit echogenic masses as compared to hypoechoic well-defined masses. And due to specific location, we can see that these are pedunculated fibroids. Now, coming to submucosal fibroids on ultrasound. On ultrasound, submucosal fibroids are typically seen as broad-based hypoechoic well-defined solid masses with shadowing. You can see from this ultrasound image, saline fluid is injected in the uterine cavity. Submucosal fibroids are appeared, and you can see that these hypoechoic well-defined solid masses, now subserosal fibroids on ultrasound. Subserosal uterine leiomyoma is a subtype of uterine leiomyoma that often exophatically projects outwards from the subserosal surface or location. If more than 50% of the fibroid protrudes out of the serosal surface of the uterus, so in this ultrasound image you can see the subserosal fibroid, okay, which protrude out of the serosal surface of the uterus. And here you can see the cervical fibroid. Fibroid is present in the cervical region, and fibroids are vascular tumors. That means they have a rich supply of blood vessels and most often coming from the uterine artery. So we have discussed few ultrasonographic appearances of different types of fibroids. Thank you so much for watching. Hope so you like it. Take care and stay connected for more updates.